we're talking about a medical condition now which affects at least 1 in 10 women, but just isn't spoken about enough.
Polycystic ovary syndrome, or PCOS, alters the way the ovaries function, which can lead to both physical and psychological symptoms. They can often be hard to spot and even harder to manage.
September is PCOS Awareness Month. So to tell us more, we've been joined now by gynaecologist Dr. Neetu and her daughter Rohini, who struggled herself with PCOS symptoms. Good morning to you both.
Lovely to see you.
Good morning. Thank you for having us.
Thank you. So let's first of all start with what exactly is PCOS?
So PCOS, or polycystic ovary syndrome, is the most common hormonal disorder to affect women. We think at least 1 in 10, but probably many more have it. In fact, anybody who's listening now will know someone they love with the condition. But PCOS does not get diagnosed easily. In fact, most women will never get a diagnosis in their lifetime.
Yeah.
It's in fact not a gynecological issue only. It's a complex endocrine disorder, not dissimilar to type 2 diabetes, but it affects mental health, reproductive health, metabolic health. And so it's so important to understand that there's a wide range of symptoms that people need to understand and then join the dots, because sometimes we just don't do that.
So what causes it, and what are some of those symptoms then?
So we don't actually know the real cause.
Right.
What we do know, it runs in families. What we also do know is that insulin resistance. Insulin is a hormone that regulates blood sugars. But we know that when your tissues get insensitive or resistant to insulin, then many of the symptoms caused by increased levels of androgens and insulin itself result in things like androgen excess, so acne in your adulthood, excess hair growth where you don't want it, hair loss, struggling with weight and finding it easier to put on weight, harder to lose weight. These are some of the symptoms, but also some of the more unspoken symptoms tend to be anxiety, depression, OCD, higher suicidal tendencies, binge eating disorders. So it's really something that we have to, and the most classic symptom, of course, is delayed periods, so long cycles, missed periods. So if anybody who doesn't have cycles within the 24 to 35 days are having regularly 40 days, 45 days, periods are coming once in 3 months, that is a big indicator. But PCOS is a diagnosis of exclusion, which means you do have to rule out other conditions, thyroid issues, early menopause. You have to rule out hypothalamic amenorrhea. You can have tumors on the adrenal glands, which are little glands on top of the kidneys, tumors in the ovaries. So it's so important that we don't just label everybody with PCOS, but at the same time, we really underdiagnose it, and that's why we are here today.
Yeah, and it's those wide-ranging symptoms, I think, that makes it so tricky to identify. Rohini, how long did it take you to get a diagnosis?
Well, it definitely took me a while. My symptoms really kicked in about 15 years ago. I was at uni, kind of living typical student life, and I got really bad acne. It was like the lower half of my face, really painful. I was losing chunks of hair from the top of my head, and I noticed that the gaps between my periods was getting longer as well, and that made me really anxious. I just didn't feel good in myself, and I would often stay in my room for days at a time, feeling really, really anxious about these symptoms and really self-conscious as well. And at the time, I put it down to I was just stressed about exams. I thought that was the problem. But when I left uni and the symptoms still kind of continued, my mum said, OK, could it be PCOS? I'd never heard of PCOS. And obviously, being 18, I don't really want to listen to my mum. But mums are usually right. And with her help, I was able to get that diagnosis. It was difficult at first to realise that all of those symptoms were connected, that they did come under this kind of PCOS, but I was trying to fight that diagnosis. I don't really know about it.
So you'd had to rule out all those other things that it could have been to get to the diagnosis. So what did you do to help alleviate some of those symptoms and to improve the situation?
Well, I was lucky because my mum's a gynaecologist, and so I went on the birth control pill, which it did really help me with some of my symptoms, like my acne and hair growth and things like that. But it was only when I started to really change my overall lifestyle, so changing what I was eating, how I was moving, that I saw the full benefit, and especially for some of those symptoms and helping my anxiety and things like that. So it was a journey. It took time to kind of figure out how everything was connected. But with her help, I was able to.
And she became so passionate. She trained as a nutritionist and a lifestyle medicine professional, and so did I.
And wrote a book about it, the two of you together, which is this extraordinary book, because you want to help other people that are going through it. It sounds like there's a lot of people that are dealing with this, and it's not the easiest thing to cope with.
Yes, and guidelines actually tell us that diet and lifestyle should be the first line of managing PCOS, but most doctors don't know that, and so most people don't know that. And yes, I do want people to know that we can offer medical help, but you also, there's so much we can do, which I'm sure Rohini will highlight, you know, because that's her speciality.
Yeah. How does it affect fertility? Does it affect it?
Yes, one of the most common causes of fertility. And if you remember, one of the classic symptoms is irregular periods or delayed periods. And that's because of something called anovulation, which means that the ovary, which is meant to release an egg most months from the ovary, doesn't do that. And that's not because it's a disease of the ovaries. PCOS is nothing wrong with your ovaries.
I always thought it was, weirdly.
It is not. It is not. It's an endocrine condition. It's signaling from the brain that is being misfired, and there's a hormonal mismatch, and as a result these eggs don't get released on time, so lots of little follicles rush to the surface trying to compete with each other, one to release, and it doesn't happen. And so again, a misnomer, polycystic ovary. There's no cysts in the ovaries. They're little immature follicles, so wrong name.
Sounds like it's been badly named.
Yes, it's actually an endocrine.
So, Rohini, there'll be people watching this morning who'll be thinking, hold on, some of those symptoms that resonates with me. So what would be your top tips if you were to turn around to say that really helped sort you out and helped you on your sort of path to where you are now?
Well, the first thing I want to say is you are not alone. You can feel so isolated when you're dealing with these symptoms. It's not exactly easy to deal with things like excess hair growth or, acne and things. But if you know someone who's struggling, then definitely get them to seek medical help and things. And then remember that there is so much you can do. And just the minute I started to accept myself and to treat myself more compassionately, to make those changes, it really helped. Because sometimes you're just told, go away, lose weight, come back when you want a baby. But actually, there's a lot you can do, starting with changing the foods that you eat. So getting more fibre, which is found in fruits and vegetables, and whole grains. So swapping out things, getting more things like oats and sweet potatoes, and then beans and nuts and seeds. So just filling your plate. As a nutritionist, I always focus on what can you add to your diet rather than what you're taking away.
Yeah, all those healthy choices will make a difference for sure. We're going to talk some more about this later on in the show because it's such a huge topic and people don't know enough about it. So